optimal care for people at the best cost. So
Jerry Jenkins,
it's really interesting.
Last September, 1,000 nurses symbolically bridged the healthcare gap by marching across San Francisco's Golden Gate Bridge. The nurses were calling for single-payer healthcare. One of the speakers was Hilda Sarkisian. Her daughter, Natalie, died after she was denied a liver transplant by Cigna Health.
I want the whole world to know that we have a broken healthcare system. I'm a mother that's gone through so much, and a lot of moms are going through the same thing that I've gone through, and we need to stop this, and we need to stop this now. If our government can have an emergency meeting to bail out $700 billion, they can always have a meeting, a 10-minute meeting for healthcare. This is so important for all of us. I wish I could go there and then face them eye to eye and tell them, only if you would do it, only if it's your own child. Because they don't care. They're getting paid every month. They're getting paid on time. They're cutting our healthcare so the CEO will enjoy his life or her life. This is not right, you guys. We're going to fight for all of us, for my daughter Natalie. She's been with me. She's been with me. She was with me last night. She came in my dream as a baby, and I know she's telling me, go mom, go get them, and I'm going to do it. The insurance company can't decide who's going to live and who's going to die. Only doctors and nurses. Thank you.
Jerry Jenkins, you are going to be holding a news conference today on Capitol Hill, an introduction of a new bill to guarantee comprehensive, quality, cost-effective health care for all Californians, as you're putting it at the news conference today. Can you explain what this is?
Well, in California, we have actually gotten a single-payer bill through the state legislature on 2 occasions, and on 2 occasions Arnold Schwarzenegger vetoed it. So we are reintroducing our bill in California today. It was SB 840. The new number is SB 810. It's being introduced by Mark Leno, and we really feel that with a change of governor in California, that we could vote in single payer in California. We've proven it can get through the legislature, not once but twice. So we think that's a significant moment. And I was involved in the Natalie thing from the very beginning, and when I was there at Cigna, when we finally pushed them, unfortunately too late, to provide a transplant for Natalie. And it's just really atrocious that we let decisions be made based on money and not on human life and what's necessary to keep people alive. The Sarkisians had insurance, and that's the telling thing here. They had insurance. They've done everything that was expected of them. They worked hard. They provided insurance, and yet when they needed it, it wasn't there for them. And I think that's really telling, because the insurance industry is here in Washington this week having their big confab, and as we read in the Washington Post last week, they're spreading a lot of money around to keep people in the legislature trying to influence the debate, to deflect away from their role in undermining the quality of care in this country by sucking 1/3 of the money out and putting it into profits and overhead and CEOs' wages, as opposed to focusing the debate on what's really going to be effective in providing health care for everyone in this country.
Russell Mokhiber, I want to bring into the conversation, longtime editor of the Corporate Crime Reporter. Russell, you're starting a new group now, Single Payer Action. Why?
On the web at singlepayeraction.org. Good morning, Amy. Well, our motto, by the way, is no compromise with the health insurance industry. And here's the situation in Washington. According to recent polling, 60% of Americans support single-payer Medicare for all. The majority of the doctors support it. The majority of the nurses support it. The majority of health economists support it. So why isn't it happening? It's not happening because the legislation, single-payer legislation, would put the health insurance industry out of business. So to be a player in Washington now, you have to kowtow to the powerful health insurance industry, and you have to say the following 6 words. Single payer is off the table. Now, who's saying single payer is off the table? The health insurance industry, the Obama White House, the Democratic-controlled Congress, and most disgracefully, even some so-called public interest groups like Healthcare for America Now, which was at this demonstration yesterday and hijacked the demonstration, and it should have been a single-payer demonstration, and it wasn't. So that's why we're creating singlepayeraction.org. We want to get 1 million people to sign up, and we want to have a direct confrontation with the health insurance industry, and there's lackeys in Congress. Take my district, the 2nd District of West Virginia. Shelley Moore Capito, moderate Republican. She comes from a coal state. She kowtows to the coal industry, no question. She takes, over 10 years in Congress, she's taken $290,000 from the mining industry. But she's taken $300,000 from the insurance industry. So we're going to get people in front of her office in Martinsburg and in front of her office in Charleston. And we are going to protest the fact that she has buckled to the insurance industry against the interests of her own constituents throughout the 2nd District. Now, 18,000 Americans, thanks to the good work of the California Nurses, Physicians for a National Health Program, we know what the answer is, and the American people know what the answer is. We know that 18,000 Americans die every year due to lack of health insurance. We know that half of the personal bankruptcies are triggered by medical bills. We know that single-payer Medicare for all would create 3 million jobs. We'd lose some jobs because you're putting the health insurance industry out of business, so you get a net 2.6 million. We know what the answer is. And I'm sick and tired of hearing, well, Obama's just a politician and he'll blow with the wind, so we have to create the wind. We need some leadership here. The reason they don't want single payer on the table is they know that if it's on the table, it's going to pass because the American people want it. Doctors, used to be doctors were against it, but now doctors are in favor of it. Nurses have been in favor of it. And it's the usual situation where the will of the American people is being stopped by the powerful players in Washington. Now, I'm going to burn this bill. I'm going from here to the Ritz-Carlton where the insurance industry is meeting, and I'm going to burn this bill. This is my health insurance bill. I pay $8,000 a year for a $5,400 deductible bill for a family of 4. And when I need the health insurance, which I did a couple years ago, I ended up in the hospital where the hospital was in network and the doctor was out of network, where they wouldn't cover the ambulance ride to the hospital. And that's just mild compared to the stories that we hear all across America. Now, there is an answer. The answer is not email campaigns. Congress is becoming immune to email campaigns. The answer is not letter writing. The answer is direct face-to-face confrontation with the insurance industry and with Congress, with your members of Congress in your district. So we're calling on Americans to sign up at singlepayeraction.org and to organize protests in front, get to know your district, your member of Congress district office. Probably less than 5% of Americans know where the district office of their member of Congress. Get to know it. Camp out there, call the local media. The local media is going to love it, and let's get this thing done. Let's push through single payer for the American people like the rest of the civilized world has. Thank you.
The chair of the Senate Finance Committee, Montana Democrat Max Baucus, has also plainly said single payer is off the table. I want to play a clip of what he had to say at an event recently. He was asked why single payer was not being considered as an option.
I know that in the Helena Independent Record, you were quoted as saying that single-payer health care is off the table. I'd like to know your reasons for putting single-payer health care off the table and intending instead to mandatory insurance payment, or I'm sorry, purchase by Americans, which is an inefficient way of guaranteeing health care to everyone.
Well, I just have to make a judgment, and I think at this time in this country, the single payer is not going to get even to first base in the Congress. And we're a big country. We're a battleship. We're an ocean liner. We're not a PT boat. We're not a speedboat. It takes time to turn those big ships. You just can't just turn them overnight. And we are, the United States of America, we're a different country. We're constituted differently than European countries, than Canada and other countries. We're a younger country. Where there's more of an entrepreneurial sense in America than those other countries. It's going to go west, young man, and in America and so forth. So we've got to come up with our uniquely American result. And our uniquely American result will be a combination of public and private insurance. but one which everyone has covered, and just my judgment, and every member of Congress agrees with me, I think, at least those I've spoken with, that this is not the time to push for single pay. It may come later, but it's not going to happen in America, in my view. So I'm not going to waste my time pushing on something that isn't going to happen.
Montana Democratic Senator Max Baucus, seen as the most important figure on Capitol Hill around the issue of health care right now, the most powerful force, with Senator Kennedy being ill. Dr. Quentin is with us now from Chicago, National Coordinator for Physicians for National Health Program. He was Reverend Martin Luther King's doctor when King was organizing in Chicago. He was a close ally